it's very important when you take out that tooth that you radiograph it. And the reason why is ideally you want to see that there's a lot of dentin right along the sides of the root. As compared to this, on this side, this area is resorbed. So when you take out this tooth, chances are you may separate the root when it comes out. On the other one, this side, if you are very slow and use very nice luxating forceps, and you're very patient, then you could probably take it out even without open surgery. The one on the left should have open surgery. So the closed extraction, the one that has the roots that are not resorbed, basically you first make an incision circumferentially with a number 11 blade, then you use a sharp luxating extraction, luxator, and you put it all the way around. And then once you, with the luxator, dislodge the periodontal ligament, it bleeds and it helps by hydrostatic pressure to take the root out in total. Now, open extractions, you make the incision right over the root and you open it up, and then you again take the luxating forceps or the elevator, put it around and take out the tooth, deliver the tooth, and suture afterwards. And this is open surgery, and we charge the clients accordingly. And it's nice to take out one of these and not have the root separate. On that point, if the root does separate, generally you could, for general practitioners, I would leave them alone, because sometimes it's just going to cause more damage and potentially damage to the adult tooth. It would be very rare to have a problem caused by a separated root. Another reason why you would want to take out teeth is if you have a missing first premolar, and you take the radiograph and the first premolar is not coming out in a good direction. It's coming out sideways like a dead soldier. And what's being formed here is called a dentiginous cyst. And that's something you certainly don't want to have, because dentiginous cysts, unfortunately, can get worse and can eventually cause a fracture of the jaw. So in this case, because it went on for a while, we would take out the second premolar, the first premolar, and probably the canine. Half of your dogs that you spay will be missing a first premolar clinically. So it's very important that you count the first molar, fourth premolar, third premolar, second premolar, and where's the first. So half of them will be missing a first premolar. So it's important to go ahead and take radiographs of these. So, and that's another reason, at least in our practice, we don't have drop-offs. We don't have spay drop-offs. Because if you do, what oftentimes will happen is that you don't get the ability to see that this poor dog doesn't have the first premolar. And if it doesn't have a first premolar, you would want to take the radiograph. But it's much better for the client to also see that, rather than call them later on the table and say, we noticed your dog doesn't have a first premolar. Can we radiograph it? And then you call them back and says, not only doesn't it have it, but it's impacted and we got to take it out and it's going to cost this. So it's so much easier to show the client on the intake that the dog has a problem.